We'll start our discussion on special senses with vision. And what we have here for vision is the color spectrum, the visible light spectrum. So when you see the sunlight, that's considered white light. And white light actually consists of the colors you see here. And when they're combined together, they appear to be white. But they can actually be broken out. And our visual abilities can actually distinguish those colors when they reflect off of something. So here's a quick little idea for you, a little bit of light physics. What color is grass? What color is your car? What color is your shirt? And for each of those questions, you immediately came up with a color in mind, and you would have said green for grass, and whatever color you think your car or your shirt is, you would have said that. But in all those cases, you would have been wrong. Light is a combination of these colors, and so when an object appears to have color, objects don't actually contain color, but they reflect light, and they reflect some of the colors of light and absorb others. So the rainbow colors, the Roy G. Biv, the red, orange, yellow, blue, indigo, and violet, and green. Those are the rainbow colors. And when that white light containing all of those colors hits something, some of those colors are absorbed by that object and some are reflected. And what you actually perceive as the color of an object is simply the color of light that's being reflected from the object. You can then assume all of the other colors of the rainbow, not associated with that particular color, are being absorbed. So when you said the grass was green, what you really should be saying is the grass is reflecting green light, which means it's reflecting blue and yellow light, which combined makes green. So everything from the blue to the yellow and all the green in between is being reflected. That means the plant is actually absorbing the reds and oranges and the purples. If your shirt or your car was reflecting certain colors, that's what's being reflected and the others being absorbed. Objects that appear white are reflecting all of the colors. Objects that appear black are absorbing all the colors and reflecting none. So if you want, in the summertime, clothing that is cooler or a car that is going to be cooler, get a light-colored car. If you want something that's going to be warmer in all conditions, pick a dark-colored object because that absorbs more of the light, therefore more of the energy. An interesting thing occurs with light and how we perceive it in the terms of refraction. And refraction occurs when the light doesn't hit an object necessarily at a perfect 90 degrees. And so if that angle is off just a little bit even, we notice that especially with water. You can see the straw entering the water here, and very clearly it's headed at a certain angle and location. But then you see the straw under the water and it's all of a sudden shifted its position. That's not the true position of the straw. The true position of the straw is to extrapolate the line of the straw it was already making above the water, but the bending of light that occurs when it hits a more or less solid object causes it sometimes to appear differently. So light is actually being bent as it passes through this relatively dense water, and then causing the imagery within it, as light is bouncing off of things, to appear in a distorted fashion. So you just come to understand that something under the water looks to be in a particular location, but it's actually a little bit off from that because the water is bending the light as it passes through. Now, if you're also underwater and the other object is underwater, you're not going to see that because everything is getting equal bending and equal distortion. But if you're above or outside the water looking into it, it certainly is going to mislead you slightly as to the exact location of a particular object. For us and our vision, focusing of light is very important. So taking the light that comes into the eye and bending it in a certain way so that it will actually be able to be focused at the appropriate point. And in the eyes, the appropriate point for that light to be focused is directly on the retina, which is at the back of the eye. The lens in the middle of the eye is going to do that focusing, along with a little bit happening in the cornea as well. But what we have here really is the idea that light comes in, it is bent by the lens at this particular point, and then refocused to a slightly different perspective. And as long as that refocusing occurs properly, then everything works. Image B here gets to the idea of not just bending something necessarily, but flipping it. So there's bending or focusing that can be done, and there's inversion and flipping of images that can be done. And both of those things happen in the eyes. Most of us have reasonable quality of vision, which means that we can see things that are close to us reasonably well, and we can see things that are farther away reasonably well. Now, the closer something gets or the farther away something gets, we might start seeing a little bit of deviation in the quality of our vision based on how well the eye is working. But here's the general idea for how focusing occurs on the lens. The lens is a rather rigid marble-like structure, but it actually gets stretched and compressed. So here in Figure A, we have the ciliary muscle, and this is going to be found actually underneath the iris. So the lens here in the middle would comprise the area of the pupil, and so that ciliary muscle can either contract or relax. And when it relaxes, that actually pulls on the lens because it's attached to the ciliary zonule, or basically a suspensory ligament. And when that muscle relaxes, that pulls on the ligament and that pulls on the lens, flattening it out. That helps to take things that are farther away and focus them deeper into the eye, or more effectively into the eye. And you can see the idea of focusing light and flipping here. So far out there we had this R. It comes in, it gets focused differently than it was coming in, and it also gets flipped. So it actually contacts the retina on the backside, upside down, and in a more focused form than it would have when it first entered the eye. If something is closer to you, you don't need as much focusing, so the ciliary muscle will actually contract, which relaxes the suspensory ligament and allows the lens to bulge or to become more round in shape. And that then focuses the light a little bit differently, and hopefully again though ends up with the idea of focusing directly on the retina. So really focusing of light coming in is done by adjusting the shape of the lens. And this is one reason why as a person ages, your vision naturally declines, because the lens is continuing to grow. It's getting thicker as you age, and the thicker it gets, the more difficult it is for that ciliary muscle to stretch it, and it becomes less effective at focusing light like it should. The eye at the top here, the emmetropic eye, is what we would call a normal eye. And so the light comes in, goes through the lens, and is correctly focused at the back of the eye on the retina. If you are nearsighted, that means that things that are up close are appropriately viewed, but things that are farther away get a little bit blurry. So what's happening is that light is coming in, it goes through the lens, and is focused, but the lens didn't focus it on the right place. The lens actually focused it out here inside the opening of the eyeball, inside where we would have the vitreous humor back here, and it didn't make it all the way to the retina. So by the time it goes past that point of perfect focus, it starts to continue in that direction of focus, but it goes too far, and by the time it hits the retina, it's perceived as being fuzzy. The closer that object gets, the further back the image is automatically projected into the eye. And so if you get it closer here, that means it pushes it farther back here, and you can get it to a just right point. You can tell someone who's nearsighted when they try to read a book, for example, they have to hold the pages closer to the face. A correction approach for that might be a concave lens, and what that does is it somewhat backs the image out of the eye, or would push it around such that when it goes through the lens, it gets focused on the right point. So maybe think of this as amplification, or artificially moving the object closer to the eye so it gets pushed far enough back into the eye itself. So we're talking about here really the lens isn't properly focusing on things. In a far-sighted eye, things that are further away you see just fine, but things that are up close are a problem. And you would notice someone with this when they're holding the book as far away from themselves as they can to be able to read it more effectively. What's happening here is the light comes into the eye, it's focused through the lens, And by the time it gets to a nice focused point, it's already gone past the retina. So it's theoretically focusing that image behind the eye. So when it got to the retina, it wasn't fully focused yet. By holding that book farther away, or by using a convex lens here, that sort of takes that image and pushes it back out a little bit, as if it were automatically farther away from the eye. And when this happens, it goes through the lens and focuses appropriately. So nearsighted and farsighted is simply a problem of where the image becomes finally focused after it passes through the lens. And so the concave or convex lenses in eyeglasses, for example, are adjusting how far away that object is perceived to be by the eye and then focused accordingly. Obviously, you can have surgical approaches that would fix this as well. I personally am not a fan of most of those surgical approaches. Many of them have been discovered to be not effective for long periods of time. And some of them involve burning things with lasers and scrubbing parts of the eye off and things like that. It's just a very aggressive approach that I personally don't really care for. And should I ever need corrective assistance to my vision, I believe I'll go with the eyeglasses approach. For the fact of I don't really trust someone to point lasers in my eye or scrub on my eye with a bristle brush or something like that. And I don't really like the idea of putting on contacts either, because I would then have to touch my eyes twice a day. I would then hope that the eyeglasses would contribute to a more scholarly air and perhaps would get greater credibility in the classroom. I suppose if that was my aim, I would also need to wear the leather arm patch jacket and carry the leather worn-out briefcase with me everywhere too. When we look at the retina, that's really where the detection of the light is occurring. We find a couple different kinds of cells there. We find rods and we find cones. And the difference between rods and cones is that rods are very sensitive to light, but they don't detect color. So rods give us quote-unquote black and white vision. Cones give us color vision. And so there are a couple of different kinds of cones, each one of them specialized on detecting either red, blue, or green light, and then putting that together into a pattern we perceive as all the rest. So here's a little bit of a comparison between the rods and cones. And so we've already said rods are more of the black and white vision, cones are color. Rods are highly sensitive. Because their function is simply to detect light and tell you there's light there, it needs to be sensitive to be able to function in areas of low light. Whereas cones have a lower sensitivity to light, so they only really work well in brighter light. And what that means is that darker areas have less color. Because color, again, was reflected light, and the color detectors are not overly sensitive to light, if there's not much of it, then you don't detect and perceive much color. Rods have low acuity, and what that means is that lots and lots of rods will merge together into one neuron to take that information on into the brain. Whereas cones have a high acuity, means one cone gets one cell to carry that message back in. So each individual cone gets a greater priority, if you will, because it has its own little wiring system to go with it. There are far more rods than there are cones in the average person, because again, when there is low light, you need lots of them to detect what's there so you can function as best as you can. Then where they're found. The cones are mostly in the central middle part of the retina. Rods are more around the outside edges of the retina. So some differences there in where you find them and how they're wired up. When we think about vision, we think about both of our eyes taking in signals and putting them into the brain. And at this point, you're aware of the idea of crossing over. And we said that the left side of the brain controls the right side of the body. The right side of the brain controls the left side of the body. And that's true for body function. And it's to some degree true to eyes, but not necessarily exclusively. And what you can see here is you can see wiring coming from each eye and going to the opposite side of the brain and also going to the same side of the brain that it's on. And so this crossing over of eyes happens at the optic chiasma, there where the optic nerve comes in to the brain, and it doesn't happen down in the medulla oblongata or other areas where we would expect crossing over to occur in the rest of the brain function. The important thing here is that if we see here, the left eye of this person can see from this edge over here over to about this point here. So you have a certain range of vision with that eye. If we look at the right eye, it starts here at this line and goes over to about this point. So you can see here that both eyes together are both getting the same input here in this dark blue and dark yellow range. The dotted yellow is where only the left eye is able to see. The dotted blue is where only the right eye is able to see. So what we're getting at here is that the eyes actually work together to give you a clear vision. So the solid blue and the solid yellow, that range would then give you well-focused vision because both eyes are doing their part. In the area where only one eye is a piece of the puzzle, that means that your focusing ability is not as clear as it would be because you only have one eye to do it, and you don't get input from the other eye to help balance it out. So really, when both eyes are able to see something, each eye does what it can, and together they achieve a greater level of clarity and function. If you're missing one eye, or one eye doesn't work, then you lose the idea of depth perception. So with both eyes, in the area where they're both focusing on that object, you get a really good idea of exactly how far away that object is. And you can tell, I'm getting very close, I'm getting very close, I'm about to touch it, I think I'm about to touch it. But if you use only one eye to look at that same object, you discover that your ability to perceive the distance that object is from you and to know exactly when you're about to touch it is quite compromised. So it's important, if possible, to have both eyes as functional as possible to get better depth perception along with a clearer image of exactly what's going on there. Smell is another important special sense that the body has. And with smell, we really can't talk much about smell without also including the idea of taste. So taste and smell are about 80% overlapped with each other. You can either say 80% of smell is taste or 80% of taste is smell. The point is they both work together. And if one of them isn't working, then you notice a distinct decline in functionality of the other because it was so heavily dependent on its sibling function to put the whole picture together. But what we want to see here is the olfactory epithelium. So the upper area of the nasal cavity is lined with these olfactory sensory neurons, and they're basically tasting the air. So smell is taste. In that layer of mucus that the olfactory cilia are located in actually has to have odor molecules dissolve into that liquid environment, and then once it's in a liquid environment it can be detected. So both taste and smell must have the molecules being detected dissolved in liquid first. Which means if you have a dry nose or a dry mouth, you're not going to taste and smell as well. If you have a lot of congestion, so extra thick layers of mucus throughout those areas, you're not going to be able to detect as well either because the molecules have farther to go to get to the receptor cells. But air passes over this. So if you think about smelling actually being tasting with your nose, is the way I like to think about it anyway. When you smell something like a skunk, you're actually tasting the skunk with your nose. Or rotting roadkill, or any other bad smell, you're tasting it with your nose. And so that perhaps puts a little bit different perspective on smelling. But those molecules that actually came from that unwonderful smelling thing are actually floating in the air, and they actually dissolve in the mucus and the liquid here, and they're actually touched by your olfactory cells. So a part of that skunk did in fact touch the inside of your nose and then get tasted by the olfactory cells. How's that for ruining your day? Taste being the other piece of this puzzle, and most of the taste that we recognize occurs on the tongue. So the tongue is covered with taste buds. But again, a little bit of smell goes on here. So here's a scenario for you. If I were to take a slice of apple and a slice of potato, they would look similar in texture, similar in color and appearance. So if you couldn't really see them, what I could do is I could place the slice of apple in your mouth, the slice of potato under your nose, and ask you what you taste. You would first say potato, because that's what you smelled. But then you would chew on that apple for a second and say, no, that's apple. So what we're saying here is that smell is the first component of taste. We could flip it and put the potato in the mouth, the apple under the nose, and you would first taste apple, then you would taste potato. This means that the smell of something greatly influences your perception of the taste of that something. So if you like the smell of a particular food, even before you've put it in your mouth, you've already decided that you're going to like the taste of it eventually as well. And so that is greatly helpful. Something that doesn't smell good is probably not going to taste good, even though there might be nothing wrong with the taste, but the nose portion of taste happened first. And as we all would understand, first impressions are often the ones that we end with as well. And it's very hard to overcome a first impression if it wasn't a favorable one. Or even if it was, and we need to change our mind later, that's challenging to do. If you look at the individual taste buds here, your tongue, and also in the back of the mouth and back of the throat, we also find more taste buds, but they're not quite as high a concentration. What we find is each particular taste bud is specialized, and it's specialized to detect something that's sweet, sour, salty, or bitter. And those are the four modes or four types of taste perceptions you can have. The book mentions a fifth taste, recently discovered, and they're very excited about this, the idea of umami. And I'm going to wave a big red flag on umami and say umami is not a true taste, because the sweet, sour, salty, and bitter actually have taste buds for that. So there are taste buds that detect sugar, taste buds that primarily detect salt, or sour, or bitter. And so those are very distinct things. And we could all agree if we placed salt on our tongue, that is salty. We could all agree if we place sugar on our tongue, that is sugary, or sour, or bitter. So distinct taste buds actually detect that. For umami, I would argue that it is actually, and it's often referred to as the delicious taste, or the savory taste. And basically that's the idea that something tastes good. If umami was truly a standalone taste bud, and truly a standalone taste, we would be able to put something in our mouth and every single person would agree that's either delicious or that's not. Because there would be a particular taste bud that activated if it was delicious, didn't if it wasn't. So I'm proposing that umami is simply a combination of sweet, sour, salty, and bitter, plus texture of the food that our brain likes the combination of. So what I think is delicious and what you think is delicious is probably two different things, because my brain might like different combinations of sweet, sour, salty, bitter, plus texture than yours would. So I'm saying umami is not a taste. It's simply an overall preference of those four tastes plus texture mixed into it. Some of you like spicy food. So let's do a little bit more life ruining for you. For those of you that like spicy food, you do not have spicy taste buds. What you have are chemical pain receptors. So spicy foods actually activate those chemical pain receptors. Your brain detects that and perceives it, in your case, as a somewhat desirable experience. So those of you who like spicy food are really saying you like pain in your mouth. A similar type of sensation could be achieved simply by biting your tongue. But anyway, the point is that substance is chemically burning the tongue, and those chemical pain receptors detect that and send it to the brain. And so if you eat something that is spicier than you are accustomed to eating, you might feel that burning sensation a little bit more significantly, and you might also notice that your taste for anywhere from a few minutes to a few days afterwards is impaired because you've chemically burned those taste buds throughout the mouth. It turns out that active ingredient, that capsaicin, does not get metabolized by the digestive system. So it turns out that it chemically burns the entire system. From the stomach through the small intestines and most of the large intestines, you don't notice that burning so much because the system is coated in mucus. But the mouth wasn't, so you felt the burning in the mouth. And then it turns out that the anus is not coated in mucus like that either, so you could possibly feel the burning again there, especially if it was a very powerful kind of spice. In the world of spicy things, we would talk about peppers, and we can say that jalapeno peppers are on the relatively mild end of spicy. If we go to the other end of spicy, we get into the idea of habaneros, ghost peppers, things like that, Carolina Reapers, things like that, that are far more concentrated in capsaicin, so far spicier. And some of those can actually cause respiratory distress. If you're not accustomed to it, it can burn the system such that it actually burns the trachea as it goes past the epiglottis and hopefully then down to the stomach. So some peppers could actually be life-threatening to some people if they got too much of it at once. Some of those hotter peppers should not be touched with bare skin. So you need to pick them with rubber gloves and don't actually let it touch your bare skin, or it would actually burn just like a flame or a hot stove or something like that would. Because I don't like pain, I don't care for spicy food. So I would go for the mild and the mildest mild I can find, and some mild sauces are a little bit more aggressive than I care to experience as well. That's just my personal approach. But remember, if you like the spicy, you like pain. We could argue from a psychological perspective there's no such thing as truly liking pain. So you're convinced yourself you like pain, and perhaps that's because you're looking for some awareness of yourself. You're looking for some degree of justification or statement of existence or something else that can get very complicated. But anyway, if you're into the spicy stuff, you're looking for pain in your mouth. And when you say something isn't spicy enough, really you're saying it's not painful enough. When we talk about hearing, hearing is a relatively simple but far more complicated than you might imagine process. And it starts with the outer or external ear. And the outer ear, at least the part that we see, is there for one purpose, and that is to capture sound waves and funnel them into the external acoustic meatus. Some of you also utilize the external ear structures for dangling decorative bits of rock and metal, and that is your prerogative, but the biological function was not, or to hang a pair of glasses from, it wasn't for that. It's just been repurposed for more decorative functionalities, but it's going to function as funneling that sound into that ear canal. Once it travels down that ear canal, it comes in contact with the tympanic membrane, or the eardrum. And that sound wave then causes the eardrum to start to vibrate. This is not actually hearing yet. This is just transferring that sound energy that was traveling through the air in a vibration wave to pass into the tissues of the body. And when the tympanic membrane starts to vibrate, then there are a set of muscles, or rather a set of bones. There are some muscles attached to them as well, but the bones behind the tympanic membrane start to vibrate as well. And so we would have the first bone, the malleus, would start to vibrate. It then would pass that vibration into the incus, and it vibrates. It would then pass that vibration into the stapes, and it vibrates. So we've transmitted that vibration from tympanic membrane, malleus, incus, stapes. The stapes connects up to this structure here in the background. This is going to be the inner ear. And when we look at that inner ear, so here's our stapes, that vibration enters the fluid here in this inner ear. And for the perspective of hearing, that vibration wave is going to pass into this cochlea, this snail-shaped structure over here. And so when that vibration goes up in here, we've transmitted it from outside the body to inside the body via the tympanic membrane, malleus, incus, stapes, now into the cochlea. If we would start looking inside the cochlea, we can see that it's a collection of channels or ducts throughout it. If we go in farther, we can see those individual ducts or channels here. And then we would look at the very surface of that, and we have hair cells. And those hair cells are going to be very critical in detection of sound. So what happens is when that sound wave, in this case that vibration, is passing through this liquid inside these canals, it causes the hairs to bend over. Those hairs, as you can see, are connected on the back side here to the cochlear nerve. So they detect this bending pattern of the hairs up here, passes that information down here to the nerve. The cochlear nerve then takes that information to the brain where it's interpreted. So hearing is actually detection of vibration. And then what pattern of vibration there happens to be is then interpreted by the brain as particular sounds. And the more significant the bending of the hairs is, the louder that sound is perceived to be. If we would look at the actual hair cells, they are actually found in rows here inside the cochlea. So here's one row and here's another row, and they're organized in these very distinct little shapes. And so these are normal, healthy hairs, and when that sound wave passes through, it would bend them, go to the cochlear nerve, and be interpreted, and life is good. But there's this idea again of how loud was it. And we measure sound in decibels. Now it's important to remember here that decibels are measured on a logarithmic scale, just like pH was. So that means if we go from a decibel sound of 30 to a decibel of 40, we had a huge change in actual intensity of energy waves there. So it's not just going 1, 2, 3, 4, it's going by logarithmic steps to a huge difference. So if we look at this here, soft music, a whisper, leaves rustling, somewhere in the 30 decibel range. Average house sounds 40. Let's say inside a car driving at 60 miles an hour might be 70. Vacuum cleaner 75. And look what happens here at 80. Sounds above 85 become physically damaging to those cochlear hairs. And the farther up the scale we go, the more significant the damage is at any particular exposure. So pushing a lawnmower, riding a riding lawnmower perhaps, is going to be in that harmful range. So if you're mowing your grass, you probably should use some sort of hearing protection. If you're familiar with subways, that's going to be 90 to 95. A motorcycle is going to be around 100. If we're talking a Harley Davidson that's been really given some gas right now, it might go well past 100 into that 130 plus range for a momentary period of time. Chainsaw, leaf blower up here in the 106 to 115 range. Rock concert might be over 120. If you're into NASCAR and you go to those live races with no hearing protection, you're going to experience hearing damage. And then if you are not using hearing protection and you fire off, let's say, a shotgun, that's going to hit you somewhere in the 140 plus. So about 125 is when actual physical pain occurs in association with that sound. So if you pop off a shotgun a couple of times right next to your ear without hearing protection, it actually physically hurts. Anything that's going to run really at 80 or above in the decibels, you probably should be engaging in hearing protection for. So remember, the difference between 30 and 140 here would be thousands of times difference in intensity of that sound wave. So if you look at what happens to those cochlear hairs, if you put very much, let's say a rock concert for example, running at let's say 125 decibels for a couple of hours, if we were to immediately look at those cochlear hairs after that experience, if we go back to what they looked like here, this was in their normal healthy condition, these hairs would all look a little bit more like this. They would be laid all over the place. They wouldn't be in nice neat rows. Some of them will be broken off. They would all be misshapen, and so your hearing would at least experience a temporary hearing loss. which is really quite unintelligent because too much of that will actually result in permanent hearing loss. When I was in high school, it was cool, as it probably still is cool today, to have a loud stereo system in your car, and the louder it was, the cooler you were. Or at least that's how we felt when we were unintelligent high school kids. And so there was a guy in my class who was very cool by this standard. And he had three 12-inch JL subwoofers linked together in the trunk of his car. Now, if you know anything about sound systems, three 12-inch JLs is some serious juice. It's going to crank out some serious sound energy with that. So he was very cool, but his car would vibrate completely top to bottom. And a number of us worked at Wendy's at that point, so when he pulled in, or when he got within about a block of the restaurant, the windows started vibrating. When he pulled in the parking lot, salt and pepper shakers started sliding across the table and falling on the floor. And if you put a quarter on the spoiler of his car, when it hit a low note, it would spontaneously flip the quarter in the air. That was the kind of sound energy outside the car, with the windows closed. What would that sound energy have been like inside the car? It would have been an incredible sound energy, well over that 125 mark. So by the time he graduated from high school, he was very cool, but he'd also lost at least 20% of his hearing. So cool has its costs. This is just a little summary of those internal structures. We've talked about the cochlea, but we haven't talked about the vestibule and semicircular canals yet. So we've talked about the hearing part of the ears. Now let's talk about the other part. So the vestibule was here where that sound energy came in and then went into the cochlea. We've got a lot of fluid here, and then we have these looping structures over here, the semicircular canals. So what happens is they're filled with fluid as well. But here in the vestibule region, we actually have these little otoliths with some support hair cells here. And as fluid passes over them, that tells us what direction the head is moving. If the fluid is going one direction, it's going to bend the hairs in that direction. But the otoliths are going to respond to gravity. So gravity always pulls down, whatever that happens to be. So the otoliths, the gravitational equilibrium doesn't lie. But as rotation or bending of the head occurs, that fluid is going to slide this whole otolith complex back and forth on those cilia, or those hairs. And then that pattern of hair bending based on the otolith membranes sliding back and forth is then calculated. It's put in perspective with the otoliths in which direction they were going, and that whole total calculation says, here's what's up and down, and here's what direction you're actually going. That helps to maintain our gravitational equilibrium and balance. There's also the idea of rotational equilibrium. So that is, are you upright and moving in a straight line, or are you spinning and rotating? And that gets into the outer areas of that vestibule area and up into the semicircular canals. So as fluid is moving through those, fluid is always going to respond to gravity, and whatever is currently down right now, fluid will go that way. If you start spinning, though, rotational gravity takes that fluid and throws it out to the outer edges rather than on the bottom. And so inside the semicircular canals at their endings are these little hair-like structures here that, just like all the other hairs we've seen so far, when something moves past it, in this case it's fluid moving across it, it bends it in that particular direction, and the body then interprets where that's going and what that means relative to your position and movement. So when you're standing at rest upright, the hair, the little cupula, is standing up. When you start rotating, the rotational gravity throws that fluid across, bends the hair that way. If you're rotating the other direction or slow down a little bit, then the rotational equilibrium throws it back this way and bends it the other direction. And that then is interpreted and processed by the brain to keep you balanced even when you're spinning. There's a little bit of a delay with this, though. So whether you were in a spinning chair or on a spinning merry-go-round, when you stop moving, it takes perhaps a couple of minutes for all of this flow of liquid to actually stabilize and for the little hairs to stand back up, and then for the brain to interpret what's really happening now. So if you're on a merry-go-round, it's going very quickly, and then you get off all of a sudden. Even though your body was actually stopped moving, the fluid in this area of your inner ear is still moving. So your brain still thinks you're spinning, even though you're actually not. And then if you try to stand up and take off walking, what happens is your brain forces you to spin some more, and it spins you onto the ground, which is entertaining if you're not the one that actually spun themselves onto the ground. So what you really would need to do is sit still for a minute or so, allow that fluid to stop moving, and now your brain realizes, I'm not moving and I'm not supposed to be moving. But while you were rotating, it was saying, okay, there's this amount of rotation, so to be upright, I have to counter-rotate with it, at least theoretically. And so it just takes a minute or two, or perhaps a couple of minutes, for all of that to sort itself out after a serious rotational event. Let's talk briefly about motion sickness. When you experience motion sickness, if you do, think about being car sick, for example, would you say that it is worse when you're in the back seat, better when you're in the front passenger seat, and perhaps it's best or even non-existent when you're in the driver's seat? If your answer is yes to those, there's two solutions for that. One is in the front seat area, you have a better view of what's going on. So your visual input to the brain is more accurate. But two, that also means there's a control issue here. So when you're in the driver's seat and you don't have the problem, that means it was really all about control. You know who you are here. If you happen to experience seasickness, if you've ever been on a cruise ship, for example, and you're in your room, your body is going to perceive the movement of that ship. So in the car, your body was moving, the car was moving, the environment was where it was. In the ship is moving and your body is moving and all that. So you have, like we've mentioned here, the analysis of what's going on with the movement of fluid in these little hairs, but you also have the visual input. So balance and equilibrium of balance is really a combination of visual input plus interpretation of this fluid movement and hair bending. So that means, again, when your vision became more accurately representative of what was going on, it was more in agreement with your inner ears and what the semicircular canals were saying. But if your eyes perceive one thing and your inner ear perceives another, the arguing or fighting over who's right about this causes the nausea, causes the motion sickness of whatever expression it might take. So in the car, the solution was get to the front so you can see better. On the ship, the solution would be to go on deck and look at the horizon. And you would then be able to see, the eyes would agree that yes, the ship is moving. Because down in your room, you were moving at the same rate and movement direction the ship was. So your inner ear was saying you're moving, and your eyes were detecting no movement and saying no, you're not. And so that yes, you are, no, you aren't, yes, you are, no, you aren't, fighting between the inner ear and the eyes was what caused the problem. So if you go up on deck, eyes can now detect what the inner ear had been telling you all along, and once they're in agreement with each other, typically problem solved. Now, if you are experiencing such a dramatic reaction from this that you can't stand up or walk straight, probably not a good idea to go on deck because that might cause more problems. But again, the overall problem is vision plus monitoring of the inner ear here that gives you the overall ability to be balanced, feel balanced, and function accordingly. Hopefully all this has been helpful to you in understanding the special senses of the body, and we could actually spend weeks on this topic if we had it, but we don't. So this is your quick and dirty version of that. Thanks for joining us, and see you next time.